Hello, welcome to Bevan University Health Board and welcome to Newport. My name is Sarah Carrington and I am the Head of Physiotherapy here in Bevan, a post that I've held for about 3 years. I actually started out 20 years ago as a brand new Band 5 physiotherapist and I have grown through the ranks to the position that I am now. At this year's CSB conference, I am really proud to showcase the breadth and depth of services that we within the physiotherapy service provide within our health board. We work across acute, community and specialist services and work in close collaboration with the wider multidisciplinary team. My experience working with Bevan has been overwhelmingly positive. I have had fantastic opportunities for career progression as well as personal development, and I've had the chance to work alongside colleagues and skilled teams who truly want to make a difference. We'd love you to come and share our journey with us, so come along and meet the team and say hello, have a look at the work that we're doing and learn how Bevan can be a great place to learn, to lead and to thrive.
My name is Claire Kellaway and I'm the Clinical Lead Physiotherapist for Trauma Orthopaedics. I've worked in Bevan University Health Board for 30 years and throughout my career I have always been supported actively to participate and lead quality improvement projects to optimise service delivery. On the Orthopaedic Surgical Unit, based in St Wallace Hospital, we are transforming elective joint replacement care through the development of a 24-hour arthroplasty pathway, a new model designed to enhance recovery, improve patient experience and optimise efficiency. The pathway focuses on enhanced preoperative education and multidisciplinary collaboration from surgeons and anaesthetists to nursing teams and therapy services. By refining anaesthetic techniques and improving pain control, our physiotherapy team are able to encourage early movement and mobilisation from 2 hours post-op. We're ensuring every patient gets the best possible start to recovery and returns home safely within 24 hours. The initiative aligns with the Health Board's vision of sustainability and patient-centred care by reducing hospital stay, freeing up capacity for increased demand, and maintaining excellent clinical outcomes. Our pathway marks a major step forward in modernising joint replacements care across South East Wales, and our physio team are proud to be part of it.
Hi, my name's Linda Tremaine. I'm a neurophysiotherapist and the development lead for the Bevan Neurostute Recovery College. We're based in Pontypool Wellbeing Centre, but we work out in the community covering all regions of Gwent, so Newport, Caerphilly, Blaen y Gwent, Torfaen and Monmouthshire. I've worked in the Health Board for 22 years. I've been really lucky. I've had the privilege of working alongside people living with the effects of stroke and brain injuries to co-develop a range of online and in-person groups. We've collectively called these groups the Neurostute, and it's based on a recovery college framework that embraces an educational model to co-develop and co-create services. This helps people to learn to live with the physical, psychological and emotional challenges after stroke and brain injury. I've really loved working in the community. I really value the opportunity to work with people and their families in their own homes and communities, especially when they're recovering from life-changing illnesses or injuries. It takes hard work, time, patience and trust for people to really rebuild their lives, but we get to make sure that it's a life worth living.
My name is Kath Dupree. I'm a specialist physio working here at Bevan Health Board Trust. I've been working here since 2002. Today I want to talk to you about some of the work that we're doing on the surgical wards at the Royal Gwent Hospital to promote mobility and patient activity levels whilst they're in hospital. We know that reduced levels of mobility and activity increase the risk to patients of functional decline and loss of their independence. So we're trying to implement interventions to safely increase mobility whilst they're on the ward. We've started an initiative to try and ensure that patients start the day by sitting out for breakfast and washes, and so they're ready and rested for physio sessions later. And this hopefully instills a culture of mobility and activity on the ward. We are actively updating nursing handovers to do this safely, but that promotes patient independence and mobility, and we give patients activity diaries so that they can track their own progress and participation. To sum up my experience of working at an Iron Bevan Health Board Trust, I would like to say that each day is different with lots of learning opportunities, and there's a real culture of development and improvement.
Hi, I'm Matt Williams. I'm an operational manager in an Iron Bevan University Health Board. I joined the Health Board back in 2014 as a rotational band 6. And what I'd like to share today is my experiences working within the Health Board and how I've been supported into developing my leadership. So initially this was quite informal, with help with projects and help within mentoring. As I then progressed into the team leadership role, I was offered in-house leadership training and was supported through an MSc in Swansea University. Stepped up into a seconded opportunity, which allowed me to practice my skills I developed in real time. But really what I wanted to say was the support and guidance that I'd been given throughout my career to that point that ultimately allowed me to be successful. I think ABUHB has a reputation of providing really good training and support for our junior staff, but I just think I'm testament to how that progresses much deeper into your career as well.
Hi, I'm Hannah Dewsbury. I'm Band 4 physiotechnician and I work in Neville Hall working on trauma and orthopaedics. I've worked as an assistant tech for over 16 years. Since starting as a Band 2 physiotherapy assistant, my development in the role has been supported on-the-job learning across inpatients. I progressed into a Band 3 role and subsequently to a Band 4 where I focused my clinical experience and knowledge within the trauma and orthopaedic speciality. I've completed the Level 3 Diploma in Physiotherapy Support through Agora Cymru, which provides me with a competency-based framework of learning, supported through my day-to-day role to gain a recognised qualification at Level 3. Gaining further competencies as a Band 4 enables me to independently manage an elective patient caseload, as well as supporting registered clinicians with delegated clinical tasks. I've been afforded the opportunity of continuing my education and development supported through ABUHB and Health Education and Improvement Wales, HEIW. I've recently commenced part-time study at the University of South Wales for a BSc Honours Physio degree part-time over 4 years. Continue to work half in my Band 4 role. This route into higher education has enabled me to take the next steps in progressing my physiotherapy career, and I've been fortunate to be afforded many learning opportunities, increasing my skills, always supported throughout my journey.
My name is Dan. I work in Monmouthshire, where I lead a team of about 15 between Chepstow and Monmouthshire hospitals. I come from a background of elite sports, and then I started working in prisons, and before working as an FCP. The thing that drew me to AB, and certainly the thing that keeps me here, is this commitment to staff development. There's a real desire for the management to ensure that we're the best physios that we can possibly be, and they provide a huge amount of support, allowing us to access courses, internal training, but especially every week they come into our place of work and we run a support clinic where people can interact with each other and ensure that we're doing the best possible job that we can do. There's lots to love about AB, and that's just part of it. But part of the reason I love it, it's beautiful countryside, wonderful locations to work, and the cycling is excellent. So I'm very happy.
Mae pob diwrnod yn edrych yn ychydig yn wahanol pan rydych yn gweithio yn y gymuned, ond mae un peth bob amser yn aros yr un fath, ein nod, helpu bobl i symud yn well, teimlo'n gryfach ac i fyw'n fwy annibynnol. Mae diwrnodau'n dechrau'n gynnar, yn gwirio amserlennu, nodiadau ac yn cynllunio ein ymweliadau am y ddiwrnod. Mae physiotherapy yn y gymuned yn dod â gofal yn uniongyrchol i'r person ac yn ein galluogi ni i weld sut mae pobl yn byw yn eu hamgylchedd, gan wneud ein triniaeth yn bersonol ac yn ymarferol. O helpu unigolion ar ôl llawdriniaeth i gefnogi oedolion hyn i fod yn actif ac yn ddiogel, rydym yn gweithio i uwchraddio ansawdd bywyd pob unigolyn rydym yn cwrdd. Yng nghanol ymweliadau, rydym yn ychwanegu at nodiadau a chynlluniau gofal ac yn gweithio gyda'r tîm ehangach. Rydym yn rhannu syniadau, yn cefnogi ein gilydd ac yn dathlu pob llwyddiant. Rydym yn gweithio ar gynyddu cryfder, addysgu ac yn annog pobl i gymryd y cam nesaf. Ar diwedd y dydd, ein rôl yw i helpu bobl symud ymlaen a parhau i wella. Physiotherapy y gymuned, lle mae gofal yn cwrdd â dealltwriaeth ac mae symudiad yn trawsnewid bywydau.
Fy enw i yw Rhys Jones, dwi wedi bod yn gweithio fel physiotherapydd yn bwrdd iechyd yn Erin Bevan dros 2 flynedd. Yn ystod yr amser yn y bwrdd iechyd hon, dwi wedi bod yn gweithio yn 6 ysbyty gwahanol a gyda 7 tîm gwych, pob un yn cyfrannu at fy natblygiad personol fel physiotherapydd. Rwy wedi cael y plesar o gysylltu gyda pobl o'r ardal hon wrth ffurfio'r perthynas therapiwtig cryf gyda unigolion, teuluoedd a ffrindiau. Rwy wedi blaenoriaethu ffocws ar adeiladu hunanhyder unigolion mwyn cyrraedd amcan personol penodol.
Hi, I'm Jill Davis. I'm a clinical specialist physio in children's orthopaedics, which I've been doing here for over 20 years, having worked in an Iron Bevan for over 30 years. And today I'm working with Hannah Bradbury in the plaster clinic. One of the favourite parts of my role is the weekly plaster clinic that we run here at the Children's Centre. We see children who walk on their toes for various reasons, and sometimes that leads to their calf muscles getting tight, and which can give them pain and difficulties standing still and balancing. So we apply walking plasters. Serial casting's an evidence-based method of stretching their tight calf muscles over a number of weeks. We assess by looking at passive range of ankle dorsiflexion by photo, which for more accuracy, and looking at the gap underneath their heel while they're standing. Then we apply walking plasters over a period of weeks. And it's just a great way of making a big change to a child's function in a relatively short period of time.